It was Christmas Day, and I was more than halfway through an intersection on a green light, and a car made a left turn right into me, almost hit me head on. And the thing, I didn't even see it coming. I just knew that I was crossing the street, and all of a sudden, just wham. The one thing I remember is that my head went way back and went way forward. I mean, it just jerked. I mean, that is just blazoned in my mind.
Just a little on-the-job accident one morning. I was, on the side of a hill, overcorrected. My hamstring just kind of balled up and popped.
I like to run a long distance, which is ultra running, and that means usually longer than 26 miles for a race. And that obviously stresses the body differently than shorter races. So maintaining, your legs are obviously is very important when you like to run those kind of distances. And then at one point, I had a knee that just was bothering me too much, and went to a lot of different people, and they tried to help me out, and they were all trying to fix the symptom as opposed to the problem.
I had vertigo, and it was just lasting for days. And it was to the point that it's like, this is not safe. I need to get something done about it. And then when I went to my physician, that's when they suggested coming and having the physical therapy. And he said, I know what kind it is. It's where these little ball things are accumulated somewhere back behind your ear area in your head. And they're in this one little pocket, and sometimes they move outward. And they come in and they do the physical therapy. And the first and only, I came back 2 more times just to make sure everything was good. But the first time they did it with the therapy, it was gone. And I haven't had it since.
I had been seeing a neurologist for migraine headaches, and had taken a ton of powerful medications. A lot of them made me feel really bad. And I got 9 pills a month is all the doctor would prescribe, and sometimes I'd have 20 headaches a month. And so I had to determine how bad my headache was one day as to whether or not to begin to take my pills.
And most of the times when I've gone to physical therapy, it's isolated where I've been. You go into, it's not a big open room. You go into one room with the little, doctor's bench and everything like that, like you're going to get blood work done. Everybody looked like they worked like such a good team. They passed off things so flawlessly to everybody else. I mean, if somebody had to do something over here, but they were working with me, Joe would be like, hey, Bree, I'm running off to this side. Can you catch this? She'd be right over, helping me out. I've been hurt so many times in the sports range, gone to physical therapy so many times. I was like, this would be an amazing thing to try.
And when I came to Results Physiotherapy and met Matt Hayes, he was trying to see why my mechanics were failing and things like that. And he actually was able to say, well, it's not your knee that's the problem, it's the other parts that contribute to that. And we were able to pinpoint exactly what that problem was. And that is when I've really had a revival in my running, because I haven't had really injuries that much since, once we figured that kind of stuff out.
Everyone was so helpful. Everyone was so concerned. There really was this feeling of concern, and we're going to get you better. We're going to get you back on track.
Get to help people out and all that. And they told me at the Hendersonville clinic, actually one of our techs is leaving. So, if you needed a place to look for a job, you can put in your application. I mean, by the end of the day, I was down at the library printing off my resume.
And so if I could say anything to anybody that's struggling with headaches, whether it's migraine headaches or just chronic headaches, it really impacted the quality of my life. It changed the way I do things.
One thing I really appreciated about my physical therapist, I think he recognized the concern that I had, but he said, don't worry, I am going to work on those muscles, and we're going to target them, and we're going to get them stronger. He said, because they have turned off, and all the other muscles in your neck now are working, and that's why you're so stiff. So it was reassuring to me to understand what was going on, and I just felt like, from that point, I could really trust him.
And when you come in, everyone will speak to you all day long. During the day, they'll ask you how you're doing, and they're very concerned about you and your life. not just the fact that you're there for the treatment, you're there and they want to know all about you and encourage you. They're so encouraging, but you know that they're truly genuine. I went back to my surgeon like 2 weeks, and he thought I was doing fabulous. And then I think I went back again in 3 more weeks, and he was very, very pleased with my progress. And so was I.
Wouldn't it be nice not to have surgery? Which means you're not at that point. And is it really that bad to go to somebody and prevent surgery? I mean, that's kind of where I don't want to have knee surgery. I don't want to have hip surgery. I don't want other things. So I'd rather trust experts to tell me what I should do. If all you did was run, and I have a lot of friends that do it, you will be injured every year. I think actually there is a statistic that says 65% of all runners are injured every year at some point. And that's definitely true. I can say I've been almost 5 years without a real injury.
I love those people at Results. I'm sorry. They know my name. They know what's going on with me. And they take care of me.